I didn't ask you how you like to be introduced. Dr. Jeffrey, Dr. Gross,
I'm I have no ego in the
Dr.
game. You can say the doctor part, then we can drop it. You can call me Jeff if you want. It doesn't matter.
Okay.
Okay.
Welcome, Dr. Jeffrey. And I love your name. It says the Stem Cell Whisperer. Welcome, Stem Cell Whisperer, to the Biohack Babes.
Thank you. Thanks for having me.
Yes, we're super excited. This is a new one for us, a new one for our audience, but I'm particularly excited as someone who had surgery and was not convinced that I really needed it. So just really thrilled that there are so many regenerative options now that you're practicing. And I think there's a lot to dig into today. But I think as a jumping off point, I found some stats before the podcast I thought were interesting, and I would love to hear your take.
Sure.
So I have read that in the US, global estimates suggest that close to 313 million surgeries are performed annually, with 500,000 lumbar spine surgeries each year. Up to 80% of spine surgery patients experience post-surgery discomfort, and 20% will experience persistent post-surgical pain. Those are some pretty astounding stats. So I'm
They are.
curious from you, how often are we doing unnecessary surgeries?
Well, that the word unnecessary might be a little too harsh, but I can
Dramatic? I can be dramatic sometimes.
I can say that surgeons are generally well-meaning, but what happens in this world is patients come in with pain, and they have usually failed non-surgical treatments like injections, therapies, medicines, time, what have you. And then the surgeon says, well, then we're left with surgery. There's nothing in between there. Well, hopefully after today's podcast, people will understand there is now something, another step, another tool before surgery. But surgery was the only thing left. And unfortunately, a lot of these surgeries were done probably overly based on the imaging, on an MRI, and not on the patient. So, and yes, many of the fusion surgeries, the bigger open spinal surgeries, and I do come from spine. That is my prior life to some extent. I still do it. A lot of these fusion surgeries with metallic hardware and implants and stuff did not leave people pain-free. We're looking for significant benefit, but that doesn't mean people don't still have symptoms. So there must be something better. We've been looking for that something better, and I think we have some options now.
This kind of like Lauren said, this is also a very exciting topic for me personally, because how many years ago? 23 years ago, I ended up with 2 stress fractures in my SI joint, herniated disc at, I think, L4, L5, and S1, something like that. And the surgeon wanted to fuse my spine at 13 years old. And my parents said, we're going to find another way. So I did. At the time, there wasn't what you're doing, at least not that I was aware of. So I did chiropractic, acupuncture, massage, PT. I did all the things, and didn't end up doing the surgery. But I think it's so exciting. We have more options now. I wish it was here 23 years ago, but grateful that it is here today. So thank you for what you're doing.
Oh, great. I like pushing the envelope here. We've been, just skirting the edge of these regenerative options here in this country for a long time in some ways. And our bodies have had this healing potential, and I know we'll get into that, I hope anyway. But we've been disadvantaged. In Europe and other places, they have been doing this for closer to 20 years.
Oh, wow. Interesting.
Okay.
So what is the delay in the US?
Well, I don't want to find myself buried in the desert, but regulatory, big pharma, big implant companies, politics, government, money.
Okay. Our
So-
shocked faces. Yeah. The US can be a little slow with things sometimes, but hey, we are where we are today. So I'm curious, what do you see as like the biggest drivers for people even needing surgery or needing some kind of treatment? Like what is causing all of this chronic pain for most people?
Well, we expose ourselves sometimes knowingly, sometimes not knowingly, to stresses. And those stresses can be physical stresses like, athletics. These days, younger kids are suggested to get in sports, keep themselves busy, stay away from distractions, get a scholarship. So we push them. There are our food is, as I know have spoken about this before, what's in our food, what goes into making our food in terms of processing, and then of course pesticides and things, our water supply, our nutrition has been leached out of our food source. Our protein, we're probably not getting enough protein, and the protein we do get is probably not the highest quality anymore for the same reasons. We do not get the proper supplements. We're exposed to electromagnetic fields all the time. This is called a smartphone. I'm sure everyone has them that and that's just an example. I mean, there's more and more, with the Internet of Things, all our devices in our home are connected to the Wi-Fi, and my robot vacuum and my ceiling fan now are work off an app. So there's all this. So we're exposed to all these things, and we degenerate. Our life expectancy in this country is, although not the best, it's really fantastic. I mean, men live to an expected age of around 79, women to about 81, 82. And we're pushing on that. So we do accumulate inflammation over time. We do age, by this process. So people have issues, they have problems, and they accumulate these problems.
Yeah.
Okay.
So would you say that inflammation or inflammaging is really the end product that leads us to potentially having a diagnosis for surgery?
I do. And I love that you know that word, because you're absolutely right. Inflammation is aging. Age is the accumulation of chronic inflammatory changes at the cellular level, at the body level, the organ level. And those affect structures, including joints and the spine. And it leaches, it negatively impacts our own stem cells, which we'll talk about. It negatively impacts our own joint hydration and what we call viscoelastic properties, the squishiness of a disc or the flexibility of a joint. And as those degenerate and stiffen, then that inflammation does take us to, oh, I've got a knee pain, I've got a knee problem, I have trouble getting out of a chair, and that gets treated, and eventually, potentially, there's a surgical recommendation, knee replacement, spine fusion, what have you.
Yeah. Oh, you go ahead, Lauren.
You mentioned so many variables that are in our control, out of our control, but of the ones that are in our control, I think movement is probably top of that checklist. But I think people struggle with how much, what's too much, what's too little, somewhere between. People can get injured from not moving. We also get injured from moving too much. So what do you think we're missing, or what do we not know? What have we not gotten right about the movement piece?
Well, I think, if you compare what we do now to what we did physically 2 decades ago, most people have access to a better understanding of how to do things mechanically correctly. Aside from maybe some of the CrossFit activities, although that's great because that's high intensity and that's really what we seek. Interval high intensity is probably one of the most efficient ways to benefit from exercise. But if we overstress a joint, then we get the benefit of the movement and the exercise, but then we also get the detriment to that joint. So we have to work within that. So if we're younger, we can probably do more. And if we're starting older, if you're in your 50s, like me, and, if you were a couch potato and you're just I want to start a health journey and I want to biohack and I want to have not only longevity, but health span. I want to have healthy longevity. You have to be really careful getting into that exercise regimen.
Yeah. Training age, I think, is something to really consider. Not a lot of people talk about that, like meeting your training age.
Yes. Yeah. Age appropriate, act your age, including your exercise.
Yeah.
I want to act younger than my age. What? No. I love that
you can work up to that.
Yeah. I love that you just said Healthspan. I actually just got back from the Healthspan Summit, and I had the opportunity to moderate a panel called Exercise for Longevity. And it was such an interesting conversation because it wasn't just like working out to lose weight. It was like, and we talked about age appropriate exercise, right? Someone that's 60 is not going to do the same thing as a 20-year-old.
Right.
Definitely an interesting conversation around the longevity health span piece.
I could not agree more. People ask, well, give me one quick tip. What can I do to reduce inflammation and support longevity? And it's probably exercise, proper exercise. We're now learning the Alzheimer's prevention. The number one thing you could do simply, there are more things, but would be an exercise regimen. It's incredibly anti-inflammatory if done right. It stimulates bone density, and muscle mass. Bone density and muscle mass are the two correlated contributors with lack of longevity. Well, the better the bone mass, the better the muscle mass, the longer the healthy longevity. Mm-hmm. And you think about it, you go to a nursing home and people that are close to leaving this earth, and they usually are wasting. They have no good bone density. They've wasted away. They've lost their muscles, particularly if they're not using them. So if you want to support your body and your mind and your health, you have to support your structures, your bone and your muscle. And what's the most rich, important component of your bone is the marrow. And what's in the marrow are most of your healthy stem cells. So if you want to support your stem cells and act and be younger and live longer in a healthy way, support your structure, exercise.
Oh, I can't wait to jump in the stem cell pool with you. This is going to be really good. But I 100% agree with you about movement. And that's our background. We were dancers. I became a personal trainer. And it's always at the top of my list. But I think just to offer some opposition, we have a 98-year-old great aunt, never exercised in her life. She's still very mobile. She hurt her knee a couple weeks ago, and so she was temporarily in a wheelchair, and she was so insistent on getting out of that wheelchair because she knows that if she stayed in it, she wouldn't be as mobile. So she was like, I got to get up and move and like work my muscles. So this is someone that never exercised, seems to be thriving physically. So obviously there's other pieces to the puzzle, and we all have our own kryptonite. So I guess what's the number 2 under movement?
It would probably be, the right nutrition and protein would probably be number 2. And that's a combination of eating your colors, eating your fruits and vegetables, eating healthier proteins, and avoiding as much processed food, sugar, which is an incredible inflammatory toxin, especially plain sugar, cane sugar, all the sugars. We need the longer term carbohydrates and grains that take time to digest, if we need them at all. I mean, you think about it, carbohydrates are really a food of convenience. You take a sandwich, you pack it, you got your lunch for the day, whatever. It's the carbohydrate makes it simple and convenient to eat what's in between it, which is usually the protein. So if we were to focus on the diet aspects of health, food is medicine, or helps us avoid pharmaceutical medicines if we eat right on a chronic basis.
Yeah.
On top of eating a healthy diet, I'm curious, do you ever recommend certain supplements for patients like chondroitin or MSM, like anything like that?
I do. So I've branched into a bit of anti-aging longevity medicine, and people will come in and we'll do a whole survey. We'll talk about their sleep, their breathing, their exercise, medical issues if they're present. We'll talk about aches and pains, and we will get into their supplement game. I got to tell you, in medical school, they do not cover vitamins and supplements much. There's a little thing on vitamins, and the RDA, which is the side of the cereal box, when it says, oh, you're getting 50% of your vitamin, D for the day. Well, that number, that percent of a number, is the number that keeps you from being malnourished. That doesn't mean you're optimally nourished. So yes, in short, I do support strategic use of supplements and adaptogens, certain mushrooms, nootropics, things like this. And we're learning more about this all the time, and it's fascinating. We're getting back to the earth and natural things. We've gotten away from it. Now we're getting back to it, like, oh yeah, that was good stuff. We didn't know why. Now maybe we know why.
Totally.
Yeah.
Totally.
Yeah.
Yeah. Vitamins and nutrition certainly getting spotlighted more and more. So You talked about supporting our natural stem cells. So we have stem cells. What happens as we age? Does it
So
drop off? What are we seeing over the
yeah,
years?
no, you're right. Just as our own cells face inflammation and degradation and degeneration, our stem cells are affected too, and their activity slows, and the circulating number slows, and our bone marrow is less robust and less dense. And if I can make a analogy I've made before, if you have had children or nieces and nephews, you have a 3-year-old, they're playing outside on the sidewalk. Little boy scrapes his knee, crying, "Mom, my knee!" Right? You clean it up. Mom puts a Band-Aid on, kisses it, off they go. Right? A couple days later, in the bath, the Band-Aid comes off, and the scab is almost completely healed within a few days. Whereas, I bumped my arm and I've got a bruise for 2 weeks. Well, how come I can't heal like that 3-year-old? I'm made up of the same genes and cell types as I was, a 3-year-old. How can I heal like that? And the thing is, we have the blueprint, we have that, we can, but we need to help our stem cells. And we need to tap back into their youthful behavior, their restorative, healing, efficient, and in some sense anti-aging, because we have seen evidence of biological age reversal with enhanced stem cell activity. So we want to tap back into that, and that's what we're doing, because yes, our stem cells are subjected to age-related inflammatory and degraded changes.
Yeah. So what exactly are you doing in your practice? Is it stem cells, peptides, exosomes, all of the above? Break that down for us.
Yeah. So we, everything's precise for a person, personalized medicine. It might just start with someone eating right, exercising right, taking the right supplements, getting the right mindset, all the above. And people who need extra help or are on the higher end of the biohacking spectrum, like me, then we turn to regenerative medicine to help. So if I can go a little bit backwards and explain some of the regenerative medicine for everyone, if that's okay.
Yes, please.
Great.
Regenerative medicine comes really in 3 main flavors. The first basic level is called PRP, or platelet-rich plasma. And that's where someone takes the blood out of you, spins it down in a centrifuge, and takes out the plasma layer, not the red part, not the white part, but the plasma layer where all the growth factors get concentrated. Because we have circulating growth factors and things. And these are proteins that are, communicated from cell to cell to help enhance things. They're the good stuff. And if you can concentrate that and put it back, like in a tennis elbow, and usually that's done over 2 or 3 periods it takes to help heal, then people get benefits because you're jazzing up the healing activity in one spot. And that's cool. And you can do that. That is, none of these are FDA approved, including PRP, but that's well accepted in the community. You can go to most docs, orthopedics, and they'll do it for you. So that's not new. In fact, there are cosmetic uses, right? There's something called the vampire facial, where you do microneedling and you put the PRP in the face. It's also done for hair restoration, because it's got the good growth factors. Probably has some exosomes in it too. We'll get to that. The second flavor, if we're moving up the ladder, would be stem cells. And you can take your own stem cells, or someone can do it for you. Although it's no fun because you have to have them harvested out of your bone marrow, and that hurts. And they're concentrated and then put back in you, whether it's into a joint or near a joint or some other place. And that's called autograft because it comes from you. It's of yours. Now I'm 57, and if you take my bone marrow stem cells and put them back into me, they're 57. So if concentrating them in one spot might help, like the PRP, but really it's the same. It's like you're changing your oil with the old oil. So it doesn't make a lot of sense. So the other source of stem cells are, you think about, well, how can I get that young 3-year-old stuff or even younger so I can heal faster like a 3-year-old? And it's called perinatal source. And these are ethical. They come from what used to be medical trash, medical waste after a C-section. So mother delivers the baby by C-section. Here's your baby. Congratulations. Can we keep your trash? It's now treasure. They take the amniotic fluid, they take the placenta, they take the umbilical cord. They can concentrate the fluids down. These are FDA compliant labs that prepare these materials. They screen the donors, they test them, they make sure everything's safe. And that's the source. We call that perinatal because it's around the time of birth source. So we can get stem cells and we can get exosomes. And that's exosomes is going to be the third flavor. And I'll talk about the difference if you'll let me keep rambling on here.
Yes.
It's perfect. Keep going
okay.
up the ladder. I love it.
Yeah.
Okay. Now, stem cells are great. They help significantly. A lot of people go out of the country for stem cells. In fact, 15 years ago, professional athletes would leave this country and go get them. They would go to Europe or Central America or Panama or Costa Rica, and now Mexico. You can go and get these, and they can advertise and bring people in, and they do plenty of stem cells, and they have a lot of experience. And it's because of the regulatory environment and what have you. So, if it's good enough for Peyton Manning and Tiger Woods, why can't we have it, right? We may not get paid that much, but it's becoming more and more available. There are many more companies and labs that make this available. So you can get that here in the US. Now, as I mentioned before we went on the air here, none of these are FDA approved. That doesn't mean they're disapproved. They just haven't been fully adjudicated yet. And what the FDA regulates is claims. So I'll say it here now, and I've said it before, and I'll say it again until the regulation changes. I can't make any claims that anything we do with stem cells or exosomes treats or cures a disease or condition, as defined by the FDA and the United States government. Do we have great stories anecdotally and results and science to back this up? Absolutely, we do. Absolutely. Am I an end user of these as well? I am. And maybe we'll circle back. So let's get to the third flavor, the exciting flavor, at least in my mind. So it turns out if you deliver stem cells, they don't last all that long, but the benefit can last weeks and months, and it could cause the type of regenerative and restorative change that is even more lasting, right? If you have a torn ligament and you use stem cells to help heal that ligament, because we do heal ourselves, and once the stem cells are out of your system and you're back to normal operating mode, you may already be healed and you don't have a problem. So sometimes all you need is a boost. But if these stem cells don't last so long, how does their benefit continue to last? Well, it turns out stem cells are only part of the recipe. Those stem cells, and actually all our cells for that matter, give off little communication packets called extracellular vesicles, or for cute, exosomes, EXOSOMES. An exosome is about 50 to 100 nanometers in diameter, and cells are measured in micrometers. So in other words, nano is 10 to the minus 9 of a meter. Micrometers are 10 to the minus 6. So it's 1,000 times smaller than a cell. An exosome is smaller, and cells can give off thousands of them. And stem cells are giving off a signal. A degenerated cell might give off a degenerated signal, but stem cells give off a youthful, healing, restorative, regenerative signal to neighboring cells and our own sleepy stem cells. So I use exosomes to activate stem cells within someone. I use them to activate the health and benefit and anti-inflammatory reparative mode of our own cells, because we do have inflammatory things going on, especially as we're accumulating that. But we also have repair. We have DNA repair. We have telomerase, which helps our telomeres, which is an age marker of the DNA. We have all kinds of reparative enzymes. We have cells that are they're called zombie cells or senescent cells. They're kind of just taking up space and using resources, but they're not doing good. We want those to go away and get redigested. And that's called autophagy. So to do that, we can now receive these labs can prepare just the exosomes. And the other beauty of it is they can concentrate them down so that if you got a dose of stem cells, it has some exosomes and they give off exosomes. But now we can just get the exosomes more concentrated as if you're getting multiple doses of stem cells at one sitting. So the exosomes are quite good. Plus, wait, there's more.
There's more.
Exosomes are small enough to travel into the nervous system through what's called the blood-brain barrier. The stem cells are not very efficient at getting into our brain and spinal cord. So I have a patient with recovering from stroke or issues related to quadriplegia, paraplegia, something like that, some kind of spinal cord issue. Exosomes are probably more efficient in delivering the type of cellular activity to the existing cells because they send the signal, the wake-up signal. Each exosome is a small bit of membrane like a cell. It doesn't have any DNA. Typically, it has some small RNAs called microRNAs that tell our cells what good proteins to make. It has growth factors and proteins like heat shock proteins, survival proteins. And if you know anything about hormesis, and you probably do, if you expose your body to light stresses like sauna, cold plunge, fasting, it releases these survival proteins, and they are anti-inflammatory and good for our cells. So exosomes are chock full of these things. So therefore, the third and final step of regenerative medicine, the current kind of best in class, are exosomes. And we're going to go further from there. We're going to have designer exosomes. We're talking already about CAR T cells and induced pluripotent stem cells going backwards with certain factors called Yamanaka factors. Those aren't commercially available at this time.
Okay.
Sorry, that was a lot.
Yeah, that was amazing. I mean, I feel like what I'm really hearing is that we're supporting the body to do its natural healing process, though, right? That's why you can't say exosomes cure this or whatever, like most biohacking things, right? We can't make claims, but we're supporting the body to do what it already knows how to do and heal and rejuvenate.
Well said.
Yes.
That was the easy way to say it.
Oh, no, you said it. I just compressed it a little bit.
Yeah. So the biggest difference between the stem cells and the exosomes are smaller. They cross the blood-brain barrier, and they're a signal that carries genetic material. Would you say that? Is there?
They carry some microRNAs. They don't carry DNA typically. They also can be delivered in a more concentrated way. And there's some evidence that they last longer than stem cells.
It's just so cool how the bar just keeps getting higher.
Yeah. And how are we delivering the exosomes? Is that a IV or is it the local injection?
So it depends. If you're biohacking, if you want to talk about anti-aging benefits, at least cellular rejuvenation. If you want to talk about dealing with helping to deal with autoimmune issues like various arthritis, Lyme's disease, all kinds of things. Generally, IV is the way to go. If you have something very specific like a knee problem, you're trying to avoid a joint replacement, you have a degenerated disc in your spine, then we would treat that directly by injection. If you're trying to restore your hair, you have thinning hair, then we would inject it into the scalp, for example.
Got it. Okay.
I'm assuming they always work systemically, but to get a slightly better benefit, you would inject locally. Is that what you're saying?
Yes, we want to concentrate it locally, not unlike PRP was used. If we're dealing with a joint or something like that, we really want them. Most of the effect there, but you're right. They're so small. You are going to get some systemic effect.
Cool. Yeah. So for something like spinal health, so many people have herniations, impingements. At what point do we bring in the exosomes? Like how far do we have to get along the degenerative line for these to be helpful? And is there a point where they're not helpful anymore?
Potentially. It depends on the individual. If it's let's call it spine pain with degeneration without nerve involvement first, then we have evidence that we can stimulate the stem cells that exist in the bone marrow above and below the disc, And those are the cells that give rise to the health of the disc. They make the cartilage proteins, they support the disc. And this comes from some really great literature from a Dr. Hernegau in France, who has over a 15-year follow-up. That's right, 15 plus years. And he's published this, and he did it in the knee. And they compared injecting the actual knee meniscus, and we can use this as sort of a parallel to the spinal disc. So they injected the meniscus in some patients, and in the other patients, they injected the bone above and below. And these were patients who already recommended knee replacement. And I said, hey, I know you need knee replacement. Would you like to join our study first and see if we can avoid that? And they had plenty of people sign up. And at the 15-year mark, and they publish every 5 years, they've been tracking these people. The patients with the bone injection above and below, where the bone marrow was stimulated, had significant benefit compared to the joint injection, the meniscus injection. So we're doing that in the spine. We're just translating that over to the spine. And in the Hernegau study, after 15 years, 85% of patients still did not need to go back and talk about a knee replacement. In the joint injection, they were down in 20% range, 20 or 25%, as I recall, meaning 75% then had a knee problem again, it wore off. They had benefit, but it wore off. Wow. Of course, you'd say, well, can they go back and do it again? And of course they could. It just wasn't part of that study. So we're applying that to the knees, to the spine, to the hips, to the shoulders. And we've been doing that now for a few years. So I'm starting to accumulate MRIs of people who we've done this on just to see. And we do have instances of regrowth of cartilage in the knee. And we're trying to duplicate that same in the spine. Now, there's the other group of patients who you started your question with, Lauren, where they have nerve involvement, impingement, herniated discs. The exosomes won't necessarily make that go away, and that might require something small, just a little cleanup, and then deliver the exosomes. But hoping we can avoid all these big fusion surgeries with screws and rods, unless someone absolutely has a loose spine or a massive trauma or something. You know, they're like we started this podcast, there's probably overutilization of those kinds of surgeries. They're well-meaning, but if we can reduce the need for that, then I think we're onto something great.
Yeah, yeah. I think my surgeon really was just doing what he thought was best, recommending for me to get my spine fused. And I'm just kind of grateful that my parents thought to look elsewhere, but I'm sure he thought that was the best option. And he actually said, if we fuse your spine, you'll be out of pain. You'll have no more pain. But I also wouldn't be able to do ballet anymore, because he says I wouldn't be able to turn my spine the way that I would need to for ballet. So for me, that was the reason to not do it. Right. But I know it was probably, he thought the best option. And actually, interesting story. So our dad, he needed double knee surgery. This was, I don't know, Lauren, gosh, 30 plus 40 years ago. I don't even know if we were born yet. He decided, I'm just going to get surgery on one of the knees and see how it goes, rather than going in for both. And, and to this day, he has more pain in the one that was operated on than the one that wasn't, which is so fascinating. But granted, that was 40 years ago. I don't even know what the surgery was, but
yeah, well,
interesting.
He's the poster child for maybe we should reserve these bigger surgeries till people are just absolutely can't function whatsoever.
Yeah. So do you see a lot of these like post-surgery patients? That's a big part. Yeah,
I do.
I just want to add to that. So he just got a full body scan, and I hope I'm relaying this information correctly, but I think they found some calcification in the knee on that one that he had surgery on. I'll have to fact check that with him, but.
All right, Dad, let us know. Tune in. Yeah. Great. So what else do we need to know about exosomes? Do we feel like we answered that?
To clarify about the spine. So if it's a herniation without an impingement, could the exosomes be helpful? Or once that disc is ruptured, bulged, kind of spilling out, is it too late?
So we're learning about this. If there's nerve involvement, for example, and the nerve down the leg is causing all kinds of trouble, I don't see, at least acutely, the exosomes taking away that physical problem, even if it does help restore the disc. So if now you created a scenario where you said there's some kind of protrusion or herniation of the disc, but there's no nerve involvement. Yes, I mean, if the protrusion is just there and it's not causing nerve involvement, I might look at the MRI, look at the patient, and see if we can use exosomes as an option. It's a simple option to try. If it doesn't work, there's always surgery. So we're trying not to do surgery. So why not try this? Yeah.
Yeah, that makes sense to me. And I guess on the topic of pain, which is just a very interesting topic, because pain doesn't always mean there's a physical problem, right?
Correct.
It could be like the brain telling us there is some perceived threat. How do you address pain in people that are coming in and kind of, I guess, determine, is there actually a problem, whether it be structural or at the joints, or if it's just a trauma response, maybe it's nerve. I feel like there's so many options in that bucket.
Yeah, I agree with you. I think my job, coming from the background of a spine doctor, is to leave no stone unturned for a physical source first. Knowing in the back of my head, of course, there's always a psychological component of pain, and I try to address that component if it seems to be a factor, but I still want to make sure there's nothing physical. So we can do imaging, we can do examinations in the office, we can do test numbing blocks, like going to the fuse box and turning off a fuse and see which lights go off in the house, right? If you can numb something in the back for a minute, it's likely that thing you numbed is where that pain's coming from. So we try to pin things down, and I am lucky to have plenty of what we call pain management colleagues in the community here, that we tap into and ask them to do these blocks, because I don't want to treat something with exosomes. Well, wait, sorry, I'm not treating. KCFDA
Supporting.
I don't want to help support someone's benefits unless I know where that pain's coming from, or what we call the pain generator. And sometimes it's more than one spot. And there are rare patients where I can't find the pain generator. And that doesn't mean those patients need surgery, but it means if we've done all the tests and we've double checked and everything, then maybe there's not a physical source of pain.
Interesting. Yeah. The pain blocking is fascinating.
Yeah.
It's rather practical, right? If you might have patients that come in with MRIs that have multiple discs don't look right, they have protrusions or degeneration or something, and the patient may not be able to pinpoint exactly, I have pain throughout my low back. We may have to go block each one at a time and see, oh, maybe it's two of them causing trouble, maybe it's all of them, maybe it's none of them, just because it's on the MRI. We have to be careful not to just treat the MRI. We have to treat our patients.
Absolutely.
Yeah. And I've heard you talk about the importance of core strength. And I think for me, like, one of the reasons I hurt my back was because I had very strong quads, weak hamstrings, amazing abs, but no like core strength. So maybe you can speak to like the importance of that and what we need to do. It's not just about like crunches in the gym. Like, how do we actually strengthen that core to prevent these back injuries?
Right. So the first and most important thing is to understand what the core is. And it's a ring of muscle groups that go around the middle of the body. It's not just the abs. And most people, when you say core, they think abs and they go do the crunches, and they end up actually more out of balance. Like you were saying, you had a muscle groups that were great and muscle groups that weren't, and that could have led to your injury. So in fact, my patients with back pain that need to rehabilitate their muscles in the back, I almost want them doing 2 or 3 times as many exercises for the back part of the core compared to the abs, because if you overdo the abs, you're actually putting asymmetric stress on a disc that we don't want for the lower back. So, and then it's doing the right exercises, because there are tons of physical therapists and chiropractors in town and across the nation. I say in town because we're in the same town, and we know what they are. There are lots of them. And some of them do good rehabilitation where they look at the muscles and they build what we need to build. And some of them just don't. They like, oh, here's a good, get on the treadmill, do this exercise, but tighten your core while you do it, And what do people do? They tighten their abs. But and that's okay.
Like,
but
what does that even mean?
you know, 10 seconds later you forget and you let the abs go. But I think it's really important to work all the muscles of the core. And then I want to highlight my friend, the transversus abdominis muscle, if you'd let me. This is a shameless plug for this muscle. The ab muscles, as you know, that make the six pack go up and down. They're called the rectus, meaning the straight muscles. They go up and down, and you know, they have those little lines in them to make the six pack or eight pack or whatever pack you're looking for. And there's a muscle behind those muscles that goes crossways called the transversus. Transverse, it goes cross. And that's the muscle that lets you suck in your belly. Okay. That is a very underutilized, but so crucial, important muscle. It is so under acknowledged. That is the muscle that helps our intestines work better. It's the muscle that helps our lung function and works with the diaphragm for proper breathing. And as you may know, we have to fill up our lungs. We have to do our yoga breaths. We have to tap into that immune tissue at the far corners of our lungs that don't always get inflated. And that's why deep breathing is very good. It settles the brainstem and excitatory brain activity. And we need that yin and yang in our existence. So you got to work the transversus abdominis just by sucking in your gut, holding it after keeping it tight and relaxing. It's a simple exercise. You can do it while you're sitting in your chair, and it's part of the core. And I think it gets missed a lot.
Yeah, that's great.
It definitely does. I used to do a lot of TVA testing with clients, and I'd have them lay on a blood pressure cuff on the floor. And it's like 99% of people would fail that test just because they haven't been taught, whether they're taught bracing or sucking in or just tightening. I mean, it is a pretty higher level skill. It shouldn't be super high, but just for the audience, if you want to see a demonstration of this, like Googling tummy vacuum is probably the easiest way to get a visual. Is there any other exercise that you're thinking of?
I'm not, no.
Yeah. Tummy vacuum. Good place to start.
All right. I'm working on it right now. Yeah, I forgot about the that blood pressure cuff test. I remember that. I definitely failed.
I'm so strong. I'm so strong. I'm not so strong.
Yeah. And what about like back? I'm assuming it's more like laying on your belly, Superman kind of style back stuff.
Superman's, bird dogs, things like that. If you go to the gym, they have that little bench that you fold your body over, and then some people hold a plate, and they arch backwards. It activates the paraspinal muscles in the lower back, the pillars that go along either side of the spine. We like to work the obliques in the back, not just the front, as well. There's a lot more talk. I mean, I'm not a trainer. Lauren can probably say much better, but about doing ab exercises when the muscle is not concentric, right? It's not contracted. So the opposite of crunches, where maybe you're like hanging upside down and you do a sit-up, or dragon flags.
Ooh, what's that?
Ooh,
dragon
that's where
flag?
You lie on your back and you hold onto a pole behind you or something, a piece of exercise equipment in the gym, and you lift your body up. So your shoulder blades are resting on the ground and your head's resting on the ground. And then you slowly lower your body as slow as you can, take as long as you can. And that is a really great way to work your rectus, more the ab muscles. And if you add a twist or an angle, you can get some of the obliques in really good. And then planks.
Oh, yeah.
And then planks are amazing. Side planks, front planks.
I love that one. We actually, in ballet, we used to do, you would lay on your back like that. You would hold the ankles of the person standing behind you, and they would push your feet.
Yes, that's similar to this. Yes.
Okay.
You see that too. Yeah, you have someone just throwing you down.
I hated that because I'd be like working my neck muscles and my hip flexors. I'm like, I am not engaging my TVA right now. Well, I would say another one that's underworked is the lower abdominals.
Yes.
I find people don't isolate those enough, and they do fatigue pretty quickly. So putting them at the end of your program, but
And how do
it's
you
such,
do that?
it's such a small movement. I mean, everyone's obsessed with doing big movements like the sit up or the reverse crunch, or I love the dragon flag or flag.
Dragon flag. Yeah.
Dragon flag. Never heard of that.
It's I
No,
think
but
it's one of Bruce Lee's favorite exercises or something like that. Yeah.
oh,
Ah.
cool.
Yeah.
Love Bruce Lee.
Like a ninja. Okay.
Yeah, lower abs would be a much more subtle exercise. So generally laying supine, knees bent, feet flat, and you would pick up your knees and do like the tiniest little rock. So your lumbar comes off of the floor, but nothing more. It's like, it's way smaller than people want it to be.
All right. I'll have to add that in.
This
All
is
right.
a challenge, talking about exercises on an audio cast.
Yeah. So you can go to YouTube and see me like waving my arms around, but that's about it.
Doing crunches with our fingers.
Yeah. Yeah. Awesome. So I'm curious, since you are a biohacker, that's actually how we first heard about you through the Biohacker University. Do you have any favorite, I would say, biohacks that people can do at home for any of this stuff?
Sure. I mean, besides adding the exercise and modifying it to be more efficient, right? You don't have to exercise hours a day. In fact, you don't necessarily have to exercise every day. But a couple fun little things. Go for a walk after you eat. Try not to eat after dinner time. You want to spend more of your time in catabolism, that's burning, than you do in anabolism, that's putting sugar and putting stuff into your cells and growing. And that's why I think intermittent feeding, some people call it intermittent fasting, is fantastic. I would lean towards a keto style diet. Make sure you get enough protein. A starter pack for your supplement game should always include fish oil, vitamin D, and probiotics. Probiotics are amazing in their anti-inflammatory capabilities. We learned nothing about this in medical school, where I went to school. And I'm learning about it now, and I've seen that there's wonderful science. There are roles in all kinds of diseases throughout our body. If we don't have the right microbiome or the bacteria in our gut, Parkinson's, Alzheimer's, other thing, there's a gut-brain axis that they're all connected. Turns out also a lot of the berries and fruits are incredible for us. Yeah, do people love vegetables all the time? Not always. If you're gonna just focus on fruits and vegetables, start with the berries. Broccoli sprouts would be the way to go vegetable wise. It has sulforaphane, which is amazing. I would add some mushroom, maybe mushroom coffee or adaptogens, which are good. There are good mushrooms and bad mushrooms. Have the good ones, they're out there.
What are the bad ones?
There's some that have toxins. I couldn't name them for you, but there's a lot of work on the ones that are bad for you are not out there commercially. But in case you're foraging in the wild, you can't just eat any mushroom you come across. And then
that's good advice. Yes.
Yeah. And then restorative sleep. So I would I want to add back in protein, but restorative sleep, making sure dark, cold room. If you have a breathing ritual, meditation ritual beforehand, turn off your screens earlier. People wear blue blocker glasses. I have some. I don't always wear them. Makes everything look yellow, but it's okay. Have your ritual, sleep well, give yourself the right amount of hours, especially if you're exercising and doing all these things. To be healthy, your body needs that. It needs that time at night. We have a light cycle and a dark cycle. We release two hormones in that circadian rhythm. In the morning, we release cortisol to wake us up. We see the sun, it gets in our retina, and it stimulates our metabolism. And then at night, we release melatonin, and we lose that efficiency after puberty. So I do believe in the use of melatonin at night, even if you don't have trouble sleeping. So you don't necessarily need it for a sleep aid. It has other cellular activities that it does. Back to the diet piece, make sure you get enough protein. I have low calorie chocolate protein powder. I put in most anything. So for dessert, I like a little yogurt fruit. I get plain yogurt, add my berries, and I put some of this protein powder in there so I can get 30 or 40 additional grams, because we should be eating round about the number of pounds of that we are in grams a day. So If you're 180 pounds, you should be having 180 grams, particularly if you want to maintain or put on muscle mass. And that's not easy. That's like a lot of chicken or beef jerky or whatever. But
Yeah.
and if you're a vegetarian, it's even harder. So make sure you have the right supplement. I also drink those little low calories. I'm very low sugar. And I don't know if you follow on Instagram, the glucose goddess, but I'm a big fan. She wears a glucose monitor and she'll tell you like, okay, I have pasta. There you go. There you go. You're wearing yours. You have pasta and you have a spike. Then she shows salad, then pasta, and how your spike's not as bad. All these little tweaks, and everyone's different. So you got to learn your own things. And I'll ask what you've learned that surprised you, maybe.
Yeah. Well, Lauren's my glucose queen, but yeah, I love just throwing it on for 2 weeks and experimenting, because you're right, everyone is so different. And unless you're testing, it's so hard to know. I think the biggest thing that really stood out to me still was I had a cassava root flour flatbread, veggie flatbread, which is like, it's gluten-free, it's vegetables, and my glucose hit 200. I've never seen above 160 ever. And that hit 200. Yeah. But there's a lot of nuances to the food. Yeah.
It's about the same amount of starch per gram as sweet potatoes, if not a little bit more. So people look at it as this healthy alternative. It's really disastrous for glucose.
Yeah.
So you learn these things. It surprises you. And, like some people will have a banana and be fine. Other people spike off the charts. So, I think it is instructive. If you really want to biohack, we should all wear those for a while, learn and test ourselves. I wanted to add though that fruits and vegetables give off exosomes. Certain exosomes that are plant exosomes, but do interact with our cells. They're small enough and similar enough in membrane that they can deliver their contents to our cells. So, besides getting the phytonutrients from plants, we're also getting exosomes. So fruits and vegetables have their thing. And, high dose vitamin C is another supplement. I take plenty of vitamin C a day. Make sure you take your D. I think I mentioned that. I was going to say about the back in the fruit and vegetable lines, there's big move now in the mitochondrial support supplements, NMN, if it's still available, and some of these things. You can also go get, NAD plus IVs at your local IV center. I'm not currently doing that here in the office because I don't want to compete with my colleagues who do just IV nutrients. But glutathione, these things are wonderful for DNA repair, antioxidant, because really antioxidant is anti-inflammation. So anyway, eat right, eat your food as medicine. Try to eat in a narrow window if you can, and these are simple biohacking steps to start with.
Yeah, thank you for sharing that list. I love it.
Sure.
I just wanted to circle back a little bit more to stem cells before we wrap up. Surrounding an exosome injection. Actually, first of all, how many injections do people get? What's kind of a standard protocol? And how do you prepare? What do you do after? What can you expect?
So there's no standard protocol per se. Everyone's different. If you came in and you were 70 years old and you've got aches and pains and you haven't been eating right for decades, one injection is not going to change you significantly. If you come in, you're trying to heal from athletic injury, you need to see a boost. If you have an autoimmune issue, you might just need one. If you're anti-aging, you might just do it periodically. I've been doing them every 3 to 4 months. I get a boost of energy, sleep better, function better. Then it starts to tail off after a few months because that anti-aging benefit probably slows at that point. Anti-aging performance optimization, biohacking benefit. If it's a joint, usually we're just doing one approach. You cannot be on anti-inflammatories because they will actually work against this, which is kind of funny, right? We are saying aging is inflammatory and vice versa. If we just took ibuprofen, we should be staying young. And it doesn't work because ibuprofen only shuts off one of the pathways of inflammation. Then the cells upregulate the others. Whereas the regenerative approach to anti-inflammatory, anti-aging works on all of them, changes the entire set of cellular pathways to one of restoration and healing. We
So you're just talking
can't
about avoiding medications or over the counter. You're not talking about nutrients, supplements that would support the healing
Correct.
process. And is there any, I guess, disadvantage? Could you potentially click over into a pro-inflammatory state with taking the nutraceuticals and exosomes, or are they going to support each other?
No, I think that they're supportive. Anything that's you're eating right. Other things we've talked about today work well with exosomes. You're eating vegetables, they give you exosomes. Fruits, they give you exosomes. Phytonutrients stimulate the same pathways. You know, it works all the way down to the cell nucleus. And if you actually look up inflammation on the internet and go to Wikipedia, it'll tell you the definition of inflammation is an increase in a protein called NF-kappa beta. That's what the definition is. So these nutraceuticals and things all work to reduce NF-kappa beta. Exosomes end up reducing NF-kappa beta. The pharmaceutical versions don't necessarily reduce NF-kappa beta. So that's why I would avoid, we have people avoid pharmaceutical, even over-the-counter anti-inflammatories, but you can do all your, turmeric, curcumin, cinnamon, all ashwagandha, all that stuff. Fantastic. It should work along with a regenerative approach to anti-inflammation. We don't treat anyone with cancer because we don't know enough yet about exosomes and cancer. We don't want to cause any trouble. So you have to be in remission for a while if you have that. People can have a flu-like syndrome for a day or two. If they have an autoimmune or Lyme's disease, it lasts longer because their body's gunked up with more of these inflammatory signals and proteins, and those have to purge, and they come out of the cells and into the bloodstream. It's why when you have flu, you have joint aches, because you have all these inflammatory proteins gumming up the works, gumming up the joints. We call them arthralgias, joint aches, and muscle aches. You feel, why am I achy everywhere? It's the flu. It should be affecting me in my lungs or something. That's why. So people will have this flu-like symptoms for a few days as they purge out and their cells switch over from pro-inflammatory to anti-inflammatory.
Yeah, I hate that achy feeling. Oof. Yeah, but good to know. Awesome. Thank you for breaking all of that down. That's super interesting.
Sure.
All right. Well, Dr. Jeff, thank you for everything you've shared today. If you can leave our audience with one final piece of advice, something they could start doing today to optimize their health, wellness, life, anything.
Sure. We all sit too much. I've been sitting here for a couple hours already. Not for a podcast, but even before, I'll be sitting here later doing work. So we should all get up, move around. We should take 10 slow, full, deep breaths, each one bigger than the next one. Just take a minute or two, do a little stretch, move around, do the belly vacuums while you're doing those stretches, 10 of those. If you just took a few minutes, a few times a day, and then go for a walk after dinner, and you do that chronically, that would be a huge, simple start on your Healthspan journey.
Amazing.
We love the simple, free advice. And I love that you said getting up after sitting, because I'm looking at you both sitting. I'm standing. I'm like, I can't wait to sit down. But I think a good balance of both, baby.
Wonderful.
Yes, balance is key. Amazing.
So tell our
ahead.
audience where they can find more of you.
I'm pretty much a novice, but we are trying really hard to put out little snippets of videos on TikTok, and you can find that at ReCELLebrate, which is the name of the practice, because you're recelebrating your rebirth of your cells. So ReCELLebrate. That's also our Instagram. Follow us. We have fun and cute videos on Instagram, and sometimes some fun information. We also have, Facebook and LinkedIn. You can find me anywhere there. And currently we're doing most of our work out of the Henderson, Nevada office, which is basically a suburb of Las Vegas. But we Zoom with people. I have people all over the country who have a knee or shoulder or something, and we talk to them first. They may need an MRI, they may need something. We don't want them coming in and doing all that. But we can set up things where people fly in. We can set up an MRI the same morning, then they see me in the afternoon, what have you. And then we see what they need. We don't approach everyone with exosomes and regeneration. We try everything else first. And then we work out a plan that's personalized for that person.
That's
So
great.
appreciated.
Yeah, I love the personalization. Awesome. We'll link to all of your links in the show notes. And
you.
I have to say, I love the name ReCELLebrate. It's just
Me too. It's
Did
so
you-
good. So
Did you
joyful.
think of that? Yeah,
I did.
I love it.
I went through a lot of, brainstorming and came up with that, and it's been fun.
It's a good
Great.
one. Yes. So more opportunities for us to re-celebrate our bodies. So good. Well, thank you, Dr. Jeffrey, for joining us today. This is such a pleasure.
Thank you
And I know
both.
our audience thanks you as well. So thank you.
Thank you.
Yes.
And thanks to everyone for tuning in. We'll see you next time.